Up to 57% of the adult population may experience tooth sensitivity. You may experience it at any point of your lifetime. In this experiment, we will look into tooth sensitivity, the causes, the treatment, and how to prevent tooth sensitivity.
Yes.
Sir, excuse me.
Sorry, rushing.
Sir, please, I'm a dental student.
Hold on.
Surveying about
experiment about
Dental student. I'll call you back.
All you need to do is just drink this water. You look thirsty. So it means that you have sensitivity.
Okay.
What is the tooth sensitivity? Basically, is the uncomfortable sensation that the patient can experience when when the teeth are exposed to cold, hot, sweet food or beverages. Basically, this kind of pain is very intolerant to the patient. That's why, as a dentist, we have to relieve this kind of pain in the patient as soon as possible. So the main factor which is going to cause the tooth sensitivity, basically the exposure of the dentine. As we can see from this model, we have this layer which is a dentine. A dentine basically consists of a million of tiny microtubules or channels which have the dentine fluid. This kind of structure which is going to cause the conduction of the stimuli due to the destruction of the enamel, which is the protective layer. The conduction of this kind of stimuli is going to cause transmission by the dentine tubules, going to be transmission to the nerve, which is basically present in the bulb, which that's going to cause the sensation of the pain in the patient. Why we have exposure of the dentine is two reasons. Basically, first of all, we have destruction of the outer layer, which is a protective layer, which is called enamel. And then we have the resetting of the gingiva or the gum, as we say. So I'm going to explain first of all why we have this kind of environmental. We have the factor which is going to cause the destruction of the enamel or the erosion or the destruction of the enamel. Basically, we have the environmental factor. Environmental factor, we have the attrition. So basically, the attrition is a grinding movement, which is involuntary movement that the patient or the individual will experience during sleep. So it's unconscious, and it's going to cause the loss of the incisal edge of the tooth or the enamel, basically, and exposure of the dentine, basically, and the feel of the sensitivity or the pain. So the abrasion basically is due to the aggressive brushing technique that the individual will gonna use, or due to the continuous chewing. Other factor we're gonna take from here is Dr. Hajar.
The third one is abstraction, which is actually crack or fracture present on the teeth. When that happens, actually plaque accumulates on it. And for that one, we'll be explaining in periodontitis. So another factor for causing erosion of the enamel is actually demineralization. That's actually the loss of mineral in the enamel. So actually during normal period, our oral cavity has this mechanism whereby our saliva will make our oral cavity more alkaline. Because when we take our food, it will become acidic. So saliva will make it alkaline. However, if we take excess acid food or soda, it will cause the cavity to be more acidic and the saliva won't be able to compensate. Therefore, demineralization will occur and the enamel will lose all its minerals and gets weak, gets thin, and therefore dentin will be exposed. That's why the patient feels sensitive.
Why we have the recession of the gum is due to basically the aggressive brushing of the tooth, which is going to cause two types of disease or abnormality in the gum. First of all, we have the gingivitis. Basically, is the inflammation of the neck of the gum or the gingiva, which is going to cause the exposure of the part of the root, and exposure of the dentine, which is going to cause the sensitivity or the pain in the patient. And then we have the Periodontitis basically also is an inflammation, but it's the inflammation of the bone and the tissue surrounding the tooth, which is gonna cause more exposure of the dentine and part of the root, which basically is gonna be destruction of the gingiva.
So now we're going to discuss how it causes the pain. So on our teeth there will be plaque, and if we don't remove it, it will be accumulation and it will become tartar, or more known as calculus. If we don't remove it properly by dentist, it will cause gingivitis, as what Dr. Aya has said. And around the teeth there's actually pockets which is around 1 to 3 mm depth. And if this gingivitis progresses, it will become periodontitis, whereby the pocket becomes deeper, which is more than 3 mm. When this happens, the bacteria will accumulate in the pocket and you won't be able to remove it properly. And when that happens, inflammation occurs and the bacteria will attract all our immune system to go there and destroy, along with all our tissues, our gum. That's why our gum is detached from the teeth, causing it to be exposed, the dentin to be exposed, so they will be sensitive. So now we'll be discussing the factors.
So the major factor which is going to cause the destruction of the enamel, basically as we say the bruxismal. Bruxism basically, as I say, is the clenching or involuntary movement of the clenching of the teeth, which is going to cause the destruction of the enamel and exposure of the dentine.
The treatment, we can provide mouth guard, which allows the patient to bite on it instead of the teeth at night.
Yeah.
And then the second factor is improper brushing.
Which is going to cause the destruction of the structure of the enamel.
The only way to fix that is for us to properly educate them on how to brush, which is either by teaching them to circular motion or 45 degrees and flick, and tell them that this kind of brushing
is no.
And they should be advised to use a softer type of bristle brush instead of the hard one. And the next factor is the
lifestyle. So as we can see, the lifestyle in our generation is different. We consume a lot of fast food. We consume a lot of acidic components, such as in the food or fruit, or even in the beverages or drinks. So as a rescue or solution of this kind of problem in the lifestyle that we have, is to reduce the our consumption of the acid, whether in the drink or in the food, and increase the calcium, and also our calcium intake, and also use maybe the
flour paste. They can also be advised to use mouth rinse or gargle every time after eating to remove the food debris.
Yeah. Another factor, we have the dental procedure. So sometimes, and only sometimes, dental procedure can cause the tooth sensitivity and weakness of the structure of the tooth. For example, we have the whitening and also the some restoration, which is going to cause the weakness of the structure of the tooth.
So whitening actually makes the enamel more permeable microscopically to dentin. That's why it becomes more sensitive.
Yep.
In this method, we should advise the patient to use mouth rinse that doesn't have alcohol, and also use mouth rinse that has fluoride instead. And they should also use the sensitizer to make it less sensitive.
Another factor which is going to cause the resetting of the gingiva or the gum, as I say, is the aggressive brushing. Is very important to be careful when you brush your teeth. And then another factor, which is gingivitis and periodontitis.
For those two, gingivitis and periodontitis, there's two conditions, mild and chronic. For mild, you should do deep cleaning, which is either scaling or root planing. Whereas for chronic, you have to do surgery, as there's no other methods.